Hi, I'm Wayne Larrabee, a facial plastic surgeon from Seattle and director of the Larrabee Center. This is my long-term friend, Lauren Gross, who's our main master esthetician. She's been with us for how long, Lauren?
22 years and counting.
Seems like longer, but 22 years and counting. Uh, you know, we've been at this 35 years. We try to be really innovative and excellent. We have a mission to kind of identify the best products, new products, particularly non-invasive ones for our patients, but also find that sweet spot. The sweet spot is after they've been proven safe and effective, but while they're still kind of new and we can introduce them to our patients. And we've more or less been really successful with that, with almost no exceptions. One area we're really proud of ourselves is with skin tightening ultrasound devices. We started Ulthera, when, Lauren?
Oh, we got Ulthera back in 2009. We were the first in the Pacific Northwest to have Ulthera. So we have been in the non-surgical tightening arena with ultrasound devices for, oh my gosh, well, how many years is that?
Do the math. Let's see, 15, take away 9. Anyway.
We've been doing it for a long time.
And roughly, how does it work and how many cases have we done, that kind of thing?
Oh gosh, thousands of cases. Let's be honest. Ultrasound devices came out in 2009. They were FDA approved initially for brow lifting, and then on for submental region as well as overall tightening of the face. All therapy, what's unique about it is that it is a two-dimensional ultrasound screen. So we get to actually see the skin that we're treating, Dr. Larrabee. I think that makes it so unique. The all therapy is going into the skin at 4.5 millimeters. That's hitting that connective tissue, which you can tell them more about connective tissue than I can, but we're tightening that muscle tissue as well as stimulating that collagen in the mid dermis. So we have a wide range of areas that we can treat with all therapy: 4.5 millimeters, 3.5 millimeters, and 1.5 millimeters. I'm sorry, 4.5, 3, and 1.5.
Yeah, ultrasound, we love the technology. It tightens essentially the SMAS, which is the same layer we tighten surgically. And it can cause little fat resorption, which can be either bad or good depending on the patient. So that's why we select it for certain people and not for others. Somewhat over 3 years ago, we were the first in our area to buy Sofwave and get into Sofwave. It's a different ultrasound technology. It goes about 300 microns deep. It goes mid-dermis. We love Sofwave because it's easy to use, not painful to apply. It can be one and done or 2 treatments depending on how we do it, but it's basically great for skin tightening in almost everyone. And we've done a lot of Sofwave also. I think, we were one of the first in CPP, for example, to have Sofwave. So we like it. And one of the things we really like is the ability, since we have both, we can kind of combine them. And Lauren's the one who does most of that for us.
Yeah, I find that we get some outstanding results, especially for those people who have that heavier neck. We're able to go in there and tighten that deeper tissue and then come back in with the Sofwave and go 1.5 millimeters into the skin. We're able to actually give them a reduction in fine lines as well as tightening that crepey skin. Overall, it's a great combination. And we're the only people, I think, in CPP that does that, aren't we?
I think so, yeah. Yes. And, I saw a patient just today referred by one of the dermatologists at the Mason Clinic, and she's getting married. She's, 53, has a slightly heavy neck, and didn't want surgery. She's very busy and travels and can't afford the downtime. So for her, I referred her to Lauren, and we're going to do the Ultherapy and the Sofwave combination to get her ready for a wedding. And I think it'll be great. So, we're always looking for the new and best things, but I think both Ultherapy and Sofwave are good choices for you. And we make individual decisions based on, who you are and what you need. So we're happy to see you in consultation.
Yeah, it's an innovative approach done by the Larrabee Center.
Exactly.
Teamwork.
Exactly.
Dreamwork.